Now to news that affects millions of women in America. The age women are expected to get their first mammogram is moving up by a lot.
Yeah, an influential U.S. health task force has reversed course on a previously controversial recommendation.
They now suggest mammograms begin at age 40. That's 10 years earlier where they used to be. Dr. Frank McGeorge here to break down their new recommendations and explain why the task force believes the proposed change is necessary. Dr. McGeorge.
Well, Kim and Devin, the recommendation actually comes from the U.S. Preventive Services Task Force. Now, this is the task force that is charged with coming up with the most evidence-based guidelines for the screening of important diseases. Their guidance is relied on by health providers across the U.S., which is why their 2009 recommendations on mammograms was so contentious.
In 2009, the task force recommended that women begin every other year mammograms at age 50. At that time, their interpretation of the data suggested that the benefit of starting 10 years earlier at age 40 did not offer much compared to the increased risk of false positive findings leading to additional testing. Dr. Lindsay Peterson is a Henry Ford Health surgical breast oncologist.
The concern is, would you miss diagnosing cancers during that time period of 40 to 50.
And this took the task force's recommendation out of line with most major physician groups, like the American Cancer Society, the American College of Obstetricians and Gynecologists, the American College of Radiology, and the American Society of Breast Surgeons, who all recommend women of average breast cancer risk begin screening at age 40. So what changed the task force's mind? Well, since 2009, there's been a consistent increase in the rate of new breast cancer diagnoses in women under 50. There's also been growing awareness of differences in both the rate and outcomes of breast cancers diagnosed among Black women. With that and other factors in mind, the task force took a new look at the data and found there was good reason to change their recommendation now that women begin mammography starting at age 40.
To have everyone on the same page is going to simplify screening recommendations for primary care physicians and for women that need screening.
Now, while the task force is changing their recommended starting age for mammograms to 40, they did not change their recommendation that the mammograms be done every other year. In fact, groups like the American Cancer Society suggest women get mammograms every year between 45 and 55, and breast surgeons like Dr. Peterson recommend annual mammograms across all ages. Now, that is something that should be discussed with your doctor. Bottom line, though, is women of average risk, they should start mammograms at 40.
Wow. Now, you say average risk. Can you go over who those guidelines don't apply to in this case?
Well, this was actually something that Dr. Peterson emphasized as well. Women need to discuss their risk in their 20s with their physician. Things that can impact a woman's risk include how many children a woman has had, when they started having children, any family history of breast cancer or cancer in general, as well as their personal breast history. All of that needs to be factored in and discussed with your doctor.
So we have competitive advice here, basically.
Yeah. Well,
from Cancer Society says one thing.
Right.
It's a little tricky for women to navigate that.
It is, and that's why it's so important to talk to your personal physician to work out what works best for your situation.
Yeah. Okay. Thanks, Doc.